This is another question, and here's a tough one, because we know that healthcare costs have been going up, and they've been going up really steadily, the rate of inflation. There's some research that shows that a married couple may need several $100,000 just out of pocket to pay for unreimbursed healthcare over the course of their retirement, because Medicare, although it pays for a lot, doesn't pay for everything. Healthcare is risk number 2. How do you help your clients prepare for that?
Well, one, make sure that it is included in your broader financial plan. A lot of people, when you ask, how much you think you're going to spend in retirement, will just give you the bills, right?
Right. Well, and that several $100,000 a year, when you break it down, is really $5,000 a person a year.
Exactly. So make sure that's included in your broader plan. The second thing is, right now, before you retire, the best thing you can do for yourself is to set up an HSA if you have a high deductible plan available at work. And the reason for that is you can make contribution into the HSA before taxes, bank that money for later, right? And then when you are retired, you can take that money out tax-free to pay for some of those healthcare expenses. So it allows you to kind of have a whole different piggy bank just for the healthcare expenses at a very tax-advantageous way.
I'm a big fan of HSAs, as I think you know, but I also think they're not right for everybody. If you've got a chronic disease that you are trying to manage, oftentimes you're better off with the traditional PPO.
Absolutely.
So in that case where you don't have access to an HSA, how do you do the supplemental savings?
You can always add it to the amount of savings you need to save. Not only you can now, but you can as the cost of healthcare goes up. As we all know, it inflates at a much higher rate than that of just, groceries, gas, and things of that sort. So we make sure that in building out a plan for you, that we include health to help determine the level of savings that you need to have now.